Anika Huff, Barbara Maya, Elizabeth Frazier, and Shamir Mackenzie were 4 out of thousands of young children who are innocently and continuously exposed to the inhumane, abusive, and violent world of child trafficking. Child trafficking, a term often associated with modern-day slavery, has affected millions of people throughout the United States. From ancient civilizations to modern generations, the act of misleading, compelling, and persuading young children with the intention of exploiting and mistreating them with unwanted sexual experiences has caused a severe issue throughout the United States of America. Good morning. My name is Anna Sophia Hubner.
My name is Johanna Ruh.
My name is Mirna Nicolai.
My name is Tom Jackson.
And my name is Inke Nguyen.
And after continuous research, we analyzed how, to what extent does child trafficking affect the United States of America's population with its impacts and effects.
After continuous research and conclusive data, we've resolved child trafficking, which it's a crucial problem ongoing in the United States. We found out that it's been starting since the human population started, and it's not gonna end by any time. Our perspectives are child sex trafficking, child labor, the healthcare system, communities, and prevention. Child sex trafficking in the United States is a big problem, and it's not talked about enough. From Dr. Mark Edberg from the University of Virginia and the Florida Department of Education, about 200,000 kids are trafficked annually, and this picture depicting a chart from 2004 and 2020 shows the percentage of kids being sex trafficked. As you can see, in 2018, 19% of young girls were trafficked, while 15% of young boys were trafficked. That was almost nearly the same percentage, while as in 2020, it was 18% young girls and 17% of young boys. This means that child predators don't look for age anymore and gender.
There are countless ways that child trafficking has impacted the United States of America. However, a term that isn't often looked enough or could actually be overlooked resides in the health and care systems of the United States of America. The healthcare system of the United States provides a safe place for child trafficking children. Whereas there are survivors or still going through child trafficking, victims often find mentally positive influences in terms of the experiences they went through and the methods in which they fought to survive. They feel relaxed, protected, and at times even more protected and less of, they feel less involved in terms of being found by owners or even members who wish to harm them. As this graph demonstrates, 88% of trafficked victims interact with medical providers. This means that not only do they continuously meet with medical providers who can help them, but that means that they are always going in and out of hospitals. This could mean that they're going through issues and probably need to be tested for significant results or diseases that could really harm them, which further demonstrates that they always need to go to hospitals or to get checked up in order to healthily survive. And as this graph demonstrates, 82% of medical workers interact with child trafficking victims, which not only demonstrates how they're always coming in and out of hospitals, but how they always have to continuously do checkups. And medical workers often have to identify red flags, which could be indicators of a child trafficking case, which could include but not limited to broken bones, broken teeth, fractured arms, or bruises, cuts, the list goes on. And at the beginning of the 20th century, after the initiation of the First World War, the Worldwide Association, known as League of Nations, argued that child trafficking was at an all-time high. This means that not only then were child trafficking cases so popular, but ever since they've only increased. Therefore, not only does this image demonstrate the continuous abuse that they go through, but how they always have to do checkups and in order to healthily survive. And medical professionals and PhD possessors, Mizera Hussein and Kathy Zimmerman, established an analytical experiment which concluded how 88% of trafficked victims out of 204 met the criteria for high levels of depression, high levels of anxiety, and extremely high levels of PTSD. Lastly, as the population of the US increases, medical professionals have been determined to be even more popular, which only serves as to demonstrate how they always need to have more doctors and always have to be trained. And that includes the processes of being able to identify more clearly for red flags for child trafficking, and how child trafficking has decreased because of this.
Child trafficking persists for many reasons. In places of war and conflict, mass displacement take place, leaving street children especially vulnerable to trafficking. In places of low poverty, families may sell their family members for money to feed their family. Another example of that is hard to escape poverty without an education. Also, in homes of domestic violence, it is difficult for the child to get out in fear of retaliation against the family. In areas of poor economy, manual labor is sought out for by migrant workers and other low economy countries. Prime candidates also to manual labor are children because they already have been through sex work.
The area in which a child resides can affect their vulnerability. As seen in the graph, where it shows both physical and social effects. An example of a social effect is the social values and norms and traditions in that area, which can lead to those being trafficked not feeling accepted, and in some cases not even being able to reach out. A more physical example is like the state laws and potential criminals in the area, which leads to a higher chance of these children being trafficked. Sex traffickers usually go for children that are vulnerable, whether that's from they've been to juvenile detention, or they are in foster care, or maybe in a broken family. Those can increase the chances of those children being trafficked. In addition to that, those that have been trafficked by loved ones, family members, or relatives can find it hard to get the justice they deserve because many adults and even law enforcement believe that people who love and care for those people cannot commit such heinous crimes. And lastly, those child predators usually go after kids by saying grand adventures, pleasure, and love and safety.
Communities coming together is playing a big role in the prevention of child trafficking. Communities also play a big role in decreasing child trafficking. As you can see in both the bottom pictures, communities are coming together to stop the child trafficking and protecting children from your communities.
Child trafficking victims often face limitations such as physical and emotional trauma, psychological impacts, shame, limited to education opportunities, lack of trust, limited support systems, health issues, and dependency on the traffickers. Victims endure physical and emotional trauma, which impacts their overall well-being. Additionally, experiences from child trafficking can lead to mental effects such as depression, PTSD, anxiety, and suicidal thoughts. Trauma at a young age may lead to a lifetime of mental health issues. The child may never recover from this traumatic event. Child sex trafficking tears apart families and communities. Solutions include educating and informing people in hope of prevention, using our votes and voices to push government officials to make the laws to prevent trafficking and protect children, training law enforcement and medical workers to look for signs for abuse and trafficking so they can offer help. In conclusion, child trafficking is a huge problem in the United States. The This is our work site. Thank you very much.
Just slide together. And Sophia, we'll start with you and work our way across with questions. First up is, how did you decide to include Mariana's paper in your overall presentation?
Mariana's paper discussed a very large topic, which was child labor and how it really affects a worldwide population, especially in the United States. So we decided to include her analysis by discussing how impactful child labor really is in the United States and how it differentiates by every work environment and employment description.
Okay, Sean, thinking about all of their IRRs and the input that they had, which one had the greatest input on you understanding the problem that you were talking about?
I think Anna's, because overall I really understand the scope of like the issue at hand and how like it's being persisted throughout time and how healthcare systems can play a big role that I never thought they could.
All right. Joanna, is there an example of an argument that one of your peers reports that you decided not to use, and then why didn't you use it?
My own essay or my argument about the prevention wasn't very much used in the slides because everyone's essay had part of mine in it, or everyone's argument had a part of mine.
Okay. Let's see. What is a way in which your team's resolution makes you think differently about the research you conducted?
I feel like child labor is different from sex trafficking, and sex trafficking is more part of child trafficking than child labor, and that was a big part of our resolution and has more of an impact on me.
Okay. And if there was a sixth person in this group, what could they have brought to that would have added to your presentation?
I think they could have brought like more data to help us better our understanding and our evidence.